And good afternoon to you, and welcome to What You Need to Know on this Thursday. So glad you're with us. We're filling in for TJ Holmes and Amy Robach. I'm DeMarco Morgan, and good to be with you again.
Good to be with you. I'm Rhiannon Alley. Dr. Jen is here as well. Give me a fist bump. There we go.
Oh, you know it.
Activate. Exactly. Can you believe it is December 15th?
No.
Have you finished your holiday shopping? No. Have you started yours?
Absolutely not. There's a saying on social media going around, and it's an older lady saying, get somebody else to do it. Get somebody else to do my shopping.
Well, we are getting so close to the holidays, but a lot of people hoping they don't get sick. So we are tracking all the day's major developments, and one of them, the big number this morning, RSV, is linked to 2.1 million outpatient visits across the U.S. among children under 5 every year.
Yeah, thousands of kids have been impacted by RSV, and right now the FDA is reviewing some type of proposal where there could possibly be a vaccine for adults.
Well, that's the hope. That's on the horizon, but I want to be crystal clear, you guys. It's not just the pediatric population. It's also older people as well, and adults, even if they're not hospitalized, are getting sick with this. You might know it if you hear people coughing and coughing and coughing for 3-4 weeks. That very well could be RSV, but let's take a look at what we know about the progress of a potential RSV vaccine. In clinical trials, they were found to be almost 67% effective in preventing lower respiratory tract illness and about 86% effective at preventing severe disease with RSV. Those are good numbers. According to Pfizer, who's one manufacturer, there were no significant safety signals. It was overall well tolerated by the participants in these clinical trials. If it clears all of these hurdles, and again, we've heard how many hurdles there are, it is possible the FDA could rule by May of this coming year, and therefore we could potentially see an RSV vaccine out in time for next RSV season. And you guys, just the numbers, how many people this affects. According to the CDC, between 60,000 and 120,000 older adults are hospitalized, and 6,000 to 10,000 estimated die of this. So again, just because we haven't really heard of this in past years while we're COVID focused, this has always been a bad actor.
Has there never been a vaccine for this before?
No. You know, like anything, to develop a vaccine takes a massive amount of money. It takes interest. It takes resources. And the need maybe wasn't there, certainly in the last couple of years when everything was focused on COVID-19. Now we're seeing more of a need, more of an interest. And so if everything goes well, fingers crossed, we could see a vaccine.
Fingers crossed.
Yeah, and once the adult one comes out, then we'll hopefully look for one for
children. And they're testing one in pregnant women as well, and the results of those clinical trials have been really good.
Dr. Jen, thank you.
You bet.
Punching bag can be used by the teachers, or if it's just meant for the students.
Oh, I bet the teachers would opt to use it, most certainly.
Could we get a punching bag here at GMA?
Why not?
Why not? GMA 3? Let's get one.
All right, Elizabeth, thank you very much. Yeah. There's a lot more ahead right here on GMA 3 on this Thursday.
Welcome back to GMA 3, and every year around this time when the snow starts falling, we hear about someone suffering a heart attack during shoveling snow.
And there's actually literature about this, you guys, in the world of cardiology, heart disease, and the American Heart Association is putting out a bulletin raising people's awareness because it's not an isolated tragedy here. As you said, every single year when there's snowstorms, blizzards, these things happen. First, let's go through the mini med school. Why does it happen, right? You're talking about a heart attack or in some cases sudden cardiac death when people are just shoveling snow. Number one, these are a lot of times people who are not fit, right? They just need to clear their driveway. They need to clear their front steps. Cold temperatures makes it a harder stress test for our heart. And then anyone who's ever done any boxing exercise or anything with your upper body, it is much more cardiovascularly stressful in terms of blood flow and oxygen supply once you add a weight. So what is in the literature? American Heart Association, they did a study in Canada, and they found that with 7 to 8 inches of heavy snow, there was a 16% associated rise in men admitted to a hospital with a heart attack and a 34% increased risk of those men dying of a heart attack after shoveling snow. So all of our awareness needs to be up on this.
You know, and just better to ask for help, you know, especially if you're not used to working out and exercising.
And listen to your body. And if you get chest pain, if you get sweaty, if you get dizzy, short of breath, nauseated, stop, call 911. This is not something that we want to hear any kind of tragedies that can be avoided.
And if you don't have family who can help you, a lot of cities, there are organizations that can help you if you can't shovel it yourself.
Listen, I used to earn extra money when I was a kid. It would snow and my mom would say, get out there.
And look at you now. It worked. It worked. You got that experience. We're back in a moment.
I hired a well-known clinical psychologist to talk about this, and this is just so shocking for so many. But I know,
so Jen, you actually lost your ex-husband to suicide. How does one even begin to heal? The bigger question is always why, and it's almost like you're left with that question for the rest of your life.
Well, when we lost Rob to suicide, and he was a doctor, he was a surgeon, and it really came out of the blue for us, my children and I immediately sought professional help, literally within 24 hours. And the way that we looked at that is if we had been in a car accident, we would be in an emergency room. And we had suffered a severe psychological trauma, and we luckily had access and were already connected to a psychologist and a therapist. That is a part of the rest of our lives, that type of mental health kind of care. I think what we learned, and by the way, we're still learning it, because the people who are left behind when they lose a loved one to suicide, every single day it's with us. And there's a process of healing that's not linear. There's ups and downs, as Dr. Gardier knows. And there are days that, you can feel like the strongest person in the world, and there are days that you feel completely shattered and cracked. But we have tried to channel our healing and our recovery into one that involves post-traumatic growth, which means having a better appreciation and sensitivity and awareness for everything in the way we live, and doing so in a way that honors Rob's memory.
Yeah, when you think of your ex-husband and you think of Twitch, I'm thinking about men. Does it impact men more than women? Because, a lot of times we're raised, tough it up, don't cry, we don't want to go see a therapist.
Able to get the attention that they need.
But you guys, I think the really important thing, in medical school, we are trained to ask someone, and Dr. Gardier can attest to this, are you having thoughts of hurting yourself or someone else? And if you ask someone that question just like that, and they tell you yes, that is a medical emergency. You should not leave that person alone. You should tell them that you are hearing their pain. There's help available. They don't have to go through this alone. And you should fill the boat, as I say in medicine. Get people to help you help that person, but knowing that they're not alone and that their pain does have an end and it's only temporary, that they will get through this, is really important. But that person needs to be in a safe place, and sometimes that's an emergency.